Hello, everyone. It's my privilege to be a moderator in this event, hopefully to many more in the future. I would like, in the beginning, I would like to express my sincere gratitude to FEB, International Pharmaceutical Federation, for organizing this event, especially to Mr. Dominique Jordan, the president, and Dr. Catherine Dogan, the CEO. Also, I extend my thanks to our honored guests and participants. I would like to welcome everyone and thank you to those joining us live and to those listening in afterwards. I'd also like to warmly welcome our guest today, who I will shortly introduce. FIB's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicine, also health technologies. Our mission is to support global health and enabling the advancement of pharmaceutical practice, science, and education. We are pleased to be delivering this event titled Regional Needs and Drivers for Transforming Vaccination, Eastern Mediterranean. So I'm going to I will be introducing myself. I am Nadia Al-Mazroui, Assistant Professor in Sharjah University, Professor in Sharjah University in Pharmacy Practice and Pharmacotherapeutics departments. Also, I am a member in WHO Expert Advisory Panel on International Pharmacopoeia and Pharmaceutical Preparation. In addition, I am President of EMRO Pharmaceutical Forum and Vice President of Emirate Pharmacy Society. I hold, prior to that, I was Deputy Commander of Armed Force Medical Services in UAE. I hold PhD in clinical pharmacy, pharmaceutical care, and disease management from Queen's University of Belfast from UK. Now I'm handing it over to Dr. Samira, the co-moderator, for presenting herself. Thank you. The floor is yours, Dr. Samira. Dr. Samira?
Do you want me to introduce myself? All right. This is Samira Shammaz Goussous. I'm a pharmacist from Amman, Jordan. Currently, I am also FIP Vice President, and I have been a member of the community section at FIP from 2006 to 2014. It's our pleasure now. Let me introduce myself more. I am a registered pharmacist, activist at an international and regional level, promoting the pharmacy profession as a healthcare provider within the healthcare system, focusing on the patient and his safety. Nationally, I already led the Jordan Pharmacists Association project for the implementation of immunization in the community pharmacy, and initiated and headed the board of good pharmacy practice and published the white print in line with WHO and FIP standards. So I think we have to start with or shall we turn to Lina?
Yeah, thank you very much, Dr. Samira, for your introduction. Now I'm introducing also our great facilitator, Dr. Alina Badr. She is she's working in the FIB, and she's leading the workforce transformation and development. Also, she led a program, especially the transforming vaccine globally and regionally. Lina, I hand it over to you, please, if you can start.
Thank you very much. Thank you very much, Dr. Nadia, Dr. Samira.
You're welcome. Thank you.
Thank you. Welcome to everybody for being with us today. I have the pleasure of facilitating the event with our prestigious moderators as well with our speakers later on. I'm pleased to just give you some information about the program. I know some of you must be already familiar with it, having been attended the many events as part of Transforming Vaccination that have been held over the past couple of months. Before that, just a couple of housekeeping notes. Just want to say that, of course, if you don't know already, this webinar is being recorded and live streamed via Facebook. We will be providing the recording afterwards on our website, www.fip.org, but also on the transformingvaccination.fip.org website. You may feel free to please ask questions in the Q&A box that you can see. And feel free to use the chat to introduce yourself and tell us where you're from. That we'd love to engage with you via the chat like that. If you have questions, use the Q&A box though, so we can pick them up. And of course, you're welcome to provide feedback to FIP about this event and any other webinars you have attended. Finally, if you aren't already, please consider joining FIP and becoming a member to enjoy the full selection of benefits we have for you. Just a little bit of background, the Transforming Vaccination regionally and globally program is the first FIP transformation outcome-based program of its kind that is underpinned by the FIP development goals, which were launched in September. The final outcome of the program is a historic global FIP commitment to action on vaccination and pharmacy, which we will be announcing in the program finale, which we'll tell you about later on. And early next year, we will be publishing a Transforming Vaccination collection, which collates and summarizes all of the outcomes of our events, the series of 24 events that make up this program. The program has been running from September and will continue to run through to December. Series 1, which was concluded between September and October, was the first of the 3 series, and it included 8 events that looked at the identification of needs to transform vaccination globally and regionally for science, practice, and workforce and education. This involved identifying the needs of the pharmacists and pharmaceutical scientists workforce to deliver on vaccination transformation on a global and regional level. The series looked at strategies and policies for global change and addressing barriers from various representatives from member organizations around the world. The second of this three series program has run between October and November. We just concluded that one last week, actually. And again, it is composed of another set of 8 episodes, which focus this time on the FIP development goals from the perspective of vaccination. We've looked at, through the lens of some of the FIP development goals, such as equity and equality, patient safety, policy development, advanced practice and specialization. We have deconstructed the vaccination agenda, and together with our speakers and contributors, identified mechanisms that can progress the vaccination agenda through the FIP development goals as a global mechanism. And series 3, the final and concluding series, which we are in at the moment, is focusing on our members across the 6 regions and how they have addressed or will address actions to deliver on the commitment to transform vaccinations locally and regionally. And this final series will be running until December 17th, which concludes with a final summit. I'm just about to play a video that shows the content of Series 3. Just give me 1 second. So that was just a video showing the 6 regions, going through them, and then ending with the Global Virtual Summit on the 17th. So if you haven't registered for this, please do as soon as possible. Visit transformingvaccination.fip.org/summit. Finally, that was the link that I just mentioned right on screen here, and we'd like you to engage with us and help us answer the following questions, and please use the chat to do that. What single factor should be prioritized to transform pharmacy vaccination services globally and regionally? What would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? What else should the FIP commitment to action outline? Please share your thoughts on chat and tell us more about the issues of vaccination you are facing locally. And here I'll be handing back over to Dr. Nadia to run through the main learning objective of today. Dr. Nadia, back to you.
Thank you, Dr. Alina. Thank you very much. In today's episode, we dissect the third of 6 regions, focuses on the regional needs and drivers for transforming vaccination in the Eastern Mediterranean region. This involves discussing the progress made in AMR countries with regards to pharmacist vaccinations, the quality and the universal access to vaccination. We also discuss barriers, challenges, and regional needs for future transformation. FIP members, stakeholders, and partners from AMR join us for the true regional perspective. Among many others, our main outcome is to understand the Eastern Mediterranean perspective in delivering on the transformation of vaccination globally and regionally. Now I'm also handing it over back to Dr. Samira to introduce our distinguished honored first speaker, Dr. Uday Nusayrat. Thank you very much. The floor is yours, Dr. Samira.
Thank you, Dr. Nadia. It's our pleasure to have with us in this event a guest speaker who we all regard and respect, Dr. Adin Serat. We will have his reflection in this session. Let me talk a little bit about Dr. Adin Serat, who is technical officer in the World Health Organizational Regional Office for Eastern Mediterranean region since January 2016. He is responsible for the planning, implementation, monitoring, and evaluation of WHO collaborative countries of the Eastern Mediterranean region. Adi has a master's degree in pharmaceutical technology. He has extensive experience in the areas of pharmaceutical regulations, pharmaceutical and medicine policy, selection and rational use of essential medicine, and supply chain management. Before joining WHO, he worked at the Jordan Food and Drug Administration as head of National Drug Use Department. So please join me in welcoming Dr. Adi and listening to his reflection in this session. The floor is yours, Dr. Adi. You're welcome.
Thank you, Dr. Samira. It is a pleasure to be with you all in this important event. I would like to thank FIP for this invitation. WHO recognized the vital importance of pharmacy and pharmaceutical workforce as a key components of the healthcare system. Pharmacists play different roles in the vaccination program, such as regulation and ensuring the safety, efficacy, and quality of vaccine through the pharmacists that are working within the National Regulatory Authority and pharmacovigilance and monitoring adverse event following immunization. Also procurement of vaccine within the public and private procurement institutions, storage and maintaining cold chain in the public and private sectors, within the drug stores, warehouses, hospital stores, and dispensary of vaccine. And also they are responsible for dispensing of vaccine in the community pharmacy. But in our region, in the Eastern Mediterranean region, immunization is provided through the existing healthcare system, primary healthcare centers, also maternity and child health centers. The health personnel who are involved in immunization, they are including the GPs, the nurses, and other trained paramedic. However, trained vaccinators are insufficient to tackle the additional load of vaccination, and pharmacists are ideal to fill this gap. Unfortunately, in most of our region, pharmacists are not involved in vaccination, and there is no regulation that listing pharmacists as health professionals who can administer vaccines. While, as you know, COVID-19 imposed challenges, it provides an opportunity to deploy pharmacists as health personnel required to administer COVID vaccine to meet the shortfall of trained vaccinators to administer COVID vaccine when it is available. So there's a need for National Pharmacy Association and our syndicates to work with the support of FIP to advocate for, first, to develop regulation for authorizing pharmacists as vaccinators in the national immunization program. Also, second, to conduct education training programs for pharmacists on vaccinating, cold chain management, adverse event following immunization, waste management, and make pharmacists a competent vaccinators. Also, to build awareness among public about the importance of immunization. Of course, pharmacists would be better suited for building public awareness, counseling, and administration. In the final, I would like to Dr. Nadia Al-Mazroui, the IMRO Forum President, Dr. Samira Shammas, FIP Vice President, Dr. Lina Badr, the lead for Workforce Transformation and Development, all speakers, presidents of pharmacy syndicates, and all participants. Let me convey my best wishes for a successful and productive event. Unfortunately, I will not be able to stay for a long time as I need to join another webinar, but I wish you a fruitful discussion, and I'll look forward to the outcomes of this meeting. And we look forward to working together, WHO, FIP, Pharmacists Association, to work together to improve the healthcare in our region through support pharmacy and pharmaceutical science. Thank you very much.
Thank you, Dr. Adi, to shed who insight on its policies and plans for vaccination and to improve the role of pharmacists within the community, as well as promoting the role of association to work actively in this role. Thank you so much for your reflections, and definitely we'll be there to work jointly with WHO for this purpose.
Of course.
Thank you so much. Yeah. We have our second speaker, Dr. Ziad Nassour. Dr. Ziad Nassour. Yeah, he's a former president of the Lebanese Order of Pharmacists from 2003 till 2009, graduated from Beirut's St. Joseph University with a PharmD degree in 1984, elected for life as a member of the French Academy of Pharmacy in 2011, member of Harvard Kennedy School Executive Education Alumni since 2012, former vice president of the Conférence Internationale des Ordres de Pharmaciens Francophones 2000 to 2013. He is in charge of combating counterfeit medication of the CIOPF since 2006 and became the reference counterfeit at CIOPF. This role led him to become an international speaker on counterfeit. Academically, Ziad teaches pharmaceutical laws and regulation and initiation to the pharmacy profession at the Lebanese American University and St. Joseph University. So welcome, Dr. Ziad. We'd like to hear and listen to your version in Lebanon for vaccination. You're welcome. The floor is yours. Hello, Dr. Ziad.
Thank you very much, Dr. Samira. Can you hear me now? Thank you very much, and hi to everybody. I hope you are all doing well and safe nowadays. Frankly, through my presentation, I did not go into big details, just to make sure I respect the 8-minute time for me. I divided the vaccines in Lebanon into two types: pediatric vaccines and adults vaccines, which is for adults, you have travelers, and the regular, the flu, and the high-risk patients. So I will go through the first issue, the regulations in Lebanon. What does the regulations in Lebanon says? Pharmacists in Lebanon, they are eligible to only dispense vaccines upon prescription from the physicians, and they are not allowed by law to vaccinate patients. Next, please. Next. So this is the regulation in Lebanon. If we go to the access issue in Lebanon, we have in the pediatric forms first, 70% of the pediatric vaccinations that are being provided to the public sector under the National Immunization Program, NIP, for free. This is what we call the Ministry of Public Health do for 70% of these vaccines. So the pharmacists in this sector do not interfere at this level. The second part, the remaining 30% of the pediatric vaccination, they are illegally provided at the private clinics of physicians at high cost money to the patients. Historically, these vaccines used to be delivered directly to physicians against the law using the cover of 4 pharmacies. So because the importers, they have no right to issue invoices in the name of physicians. They issue invoices in the name of 4 pharmacies only in Lebanon, and they give it to the physicians. This year, the Lebanese Order of Pharmacists managed to issue a memo from the Ministry of Public Health, stopping this illegality and obliging the importers to deliver these vaccines only to pharmacists, all of the pharmacists, not only the 4. And the pharmacists will dispense the vaccines to patients upon prescription only. And this is what the actual law says. But this memo has put at rage the physicians. Next, please. So the other issue of the access to vaccination is the adults issue. For the adults issue, we have what we call the travelers vaccines or tourism vaccines. They are given at the airports to the travelers at full price by the Ministry of Public Health. So we have no direct impact at the pharmaceutical level. You know, we are talking about yellow fever and meningococcus and other vaccination. The second adult vaccination is the flu vaccination. The flu vaccination, historically, half of this vaccination was dispensed and administered to patients directly at the pharmacy level without any law covering this. We have no law, but the pharmacists, they used to buy it from the importers and give it to patients and administer to the patients also. And the other half was bought illegally also by the physicians through 4 covered pharmacies, which is against the law, because the law, they forbid the importers to sell any medicine to the physicians. Again, this year, the Lebanese Order of Pharmacists managed to issue a memo from the Ministry of Health allowing the pharmacists to administer these flu vaccines. So this year, we are covered by a memo dated of this year, allowing the pharmacists to administer the flu vaccine to the population. So because we have the COVID-19 this year, we had a shortage in the vaccination of flu because everybody wanted to do the flu vaccine before the coming COVID vaccine. So we had at the OPL to work with the importers to ensure equity in flu vaccines distributions, because we have a lot of shortage at this moment. Again, this has put at rage the physicians, because they were also put aside from this vaccination. Because the memo obliged the importer to sell only the pharmacist and allowed him to administer the vaccination flu to the patients. Third, the vaccination for high-risk people. When I say high-risk people, I mean the people who has hepatitis, varicella, pneumonia, these kind of people. We have no shortage in Lebanon. The access is available. Pharmacist role is directly in the awareness campaign. So there is no problem in this section of vaccines. Next, please. Next. So now we go to the barriers facing pharmacy vaccination in Lebanon. If I can put only one word, I would say physicians, pediatricians. They are the main, let's say, barrier we are facing here. Frankly, this year, with the memo issued by the Ministry of Public Health upon request from the OPL, limiting pediatrics vaccines and adult vaccine to be dispensed at the pharmacy level as it should be by the law, the reaction of the physicians was very tough. They started lobbying to change the law in Lebanon. Changing the law, they proposed a law in the parliament to remove vaccines from the international classifications of medicines. They want the vaccines not to be considered as medicines. This will be, the result of this will be that the vaccines won't be registered at the Ministry of Public Health, nor studied by the technical committee as a medicine, nor have a fixed price, and it could be bought then by physicians directly from the importers, and then they could be sold, it could be sold by the physicians directly to the patients. You know, this will, it reminds me of as if it will be as we did not separate the profession of physician and pharmacist 200 years ago. They want to combine the profession of physician and pharmacist together. So the Lebanese Pharmacist Order, they stopped this lobbying. We went to the parliament with the help of the Minister of Public Health. They did not rest yet till now. They go on media, on Facebook, putting pressure on the Minister of Public Health, but they will not win this lobbying, because we won the public, the population with us. Next, please. So what is our future vision, and what do we need for to facilitate progression of vaccination by pharmacists? Well, I can say we need 4 things at least. The most important role, frankly, of the pharmacist, beside dispensing medicine, is the prevention. This is our role of pharmacists. Awareness, education, this is the pharmacist. In order to reduce diseases, vaccination is a tool to prevent diseases. So, if we want to vaccinate the largest population possible, we should amend the law allowing pharmacists to administer vaccines to the population. This is the correct way to spread the vaccination and then to reduce diseases among the population. But before that, we should do one thing. We should train the pharmacist, allow him to get a diploma, certificate, not go to university for 1 year, 2 or 3 days, 1 week maybe, to train him, to be able to vaccinate patients, to know which patients needs to be vaccinated, which not, which is where he can do it, why he cannot do it. This is important to have a trained, certificate pharmacist to push after that, to amend the law, to let the pharmacist be the initiator in administrating the vaccination, and then in consequences to that, reducing the diseases in the populations. Third, we recommend a common declaration between WHO and FIP. This common declaration urging the governments to amend the law in each country, letting the pharmacists, the trained pharmacist with diploma of certificate, allowing him to administer the vaccines to the population. And the last recommendation, sharing the experience with other countries that succeeded before us this transformation. This is what we had to say in the Lebanese section. So I say this is our point of view. Thank you very much.
Thank you, Dr. Ziad, for this honest and clear version of the Lebanese experience. Hopefully that by the end, you will be able to come to a point whereby the pharmacist will offer his services. Let me point out one important step, that FIP will be sending very, very soon a kind of policy statement to our member organizations, urging the Minister of Health to help in this field by providing facilities for pharmacists to be immunizers. Anyway, thank you very much, Dr. Ziad.
If I can just add one word.
Please go ahead.
The problem, the major problem that the physicians are evoking in Lebanon by changing the law is that they want to consider the vaccines not a medicine and the classification. And this is very wrong. We gave them all examples in the United States, in Canada, in France, in Europe, in all the countries, in the Arab countries, we have not such a thing. The international classifications, the vaccines are considered as medicine. So please, if it goes to FIP, talking to WHO, please stress on this, this point. Vaccines will always be a medicine with the technical files to be studied and to be dispensed upon the pharmacist. Thank you very much.
Thank you for your point of view. Taking care. Dr. Nadia The floor is yours.
Thank you very much, Dr. Samira. I am now pleased to be introducing Professor Ala Hayallah. Professor Ala Hayallah is a professor of pharmaceutical chemistry at Asyut University and leads Daria University Faculty of Pharmacy with a deep commitment to shape another dimension of knowledge to achieve the best ever educational system as a core mission of his Deanship for Education and Students Affairs. Professor Hayallah also, he is known for his excellence and innovative research on chemistry, particularly on pharmaceutical organic chemistry. He published more than 60 scientific papers in international journals and more than 40 scientific lectures in international conferences. Now, Professor Hayallah works as a Vice Dean for Education and Students Affairs, Faculty of Pharmacy in Sphinx University, Asyut. Hayallah received a PhD from Bonn University, Germany in 2003. He served as a lecturer and postdoctoral researcher, LMES, Life Program Unit, Chemical Biology and Medicinal Chemistry, Bonn University, Germany in 2006. Later, Professor Hayallah received a prestigious Asyut University Award as the best ever scientific research in field 2015. He is Asyut Pharmacist Syndicate Chairman since 2015 and Vice President of International Operation Smile Committee Egypt in 2016. Thank you, Dr. Professor Hayallah. We can now welcome to the board and you can start your presentation. Thank you, Dr. Hayallah. The floor is yours.
Good evening, everybody. You heard me?
Good evening.
Great thanks, Professor Nadia Mazroui, for this nice introduction. Good evening for all, Dr. Samira, Dr. Lina, and all respective speakers. Actually, first of all, it's a great honor for me to be invited in this respective international conference of FIP. First of all, I would like to overview vaccination, role of pharmacists, improvement of pharmacist rules, obstacles of pharmacist participation in vaccination process, support of FIP, society culture about vaccination. Next, please. The objective from this slide, I'm not going to define a vaccination. I know very well I am talking among big names and scientific peoples, but the objective of this slide and definition of immunization is a global health and development success story, saving a million lives every year. Vaccine reducing risk of getting disease by working with body natural defense. The objective from this slide, as I said, to explain or discuss the importance of vaccination and the vaccination process. Next paragraph, please. We now have vaccines to prevent more than 20 life-threatening disease. I'm not going to classify vaccination, childhood vaccination and adult vaccination, because I know very well you know this classification. The objective from definition, next please. If we are going to make a real participation of pharmacists in vaccination process, especially nowadays in COVID-19 and need of us to vaccination, pharmacist role in vaccination has expanded to some countries, as pharmacy have a greater authority to perform various immunization activity from vaccines, storage, vaccine adverse event, reporting vaccine, education, and advocacy of vaccine administration. However, pharmacist present involvement in vaccination service is poorly understood across low and middle income countries is still limited. And we must face this problem. Next, please. If we are going to solve a problem, we must diagnose the problem. Pharmacists have a potential to play an important role in increasing access of vaccine coverage and the evidence. And we, from this point of view, we discuss the obstacles, how the problems facing the pharmacist in vaccination process. Next, please. If we are going to prepare a good pharmacist, and we are not in a fighting, we are going to cooperate in the healthy triangle, including a physician, pharmacist, and the nurse. If we are going to make a pharmacist sharing or participate in a vital role in vaccination process, first of all, we must prepare our pharmacist. We need pharmacy-based immunization training for pharmacists. It's very important. Community pharmacists are valuable source of information for a patient. Let us frankly speaking, in Egypt, the vaccination distributed through the governmental hospital and the general hospital, because the childhood vaccines in Egypt all paid by government. So supplied through hospitals and the governmental hospital. If we are going to make an important rule for community pharmacists, then we must prepare the community pharmacists for this program. As vaccine educators, pharmacists act as educate and recommend patients the importance of and in need of receiving vaccines. Community pharmacists also educate the community through campaign and distributing literature on the need of vaccination to obtain the needed vaccines. My request now, we need an active immunizing pharmacists. And my request from FIP and WHO, we start education program for Egyptian pharmacists. I prefer, of course, to start from Asyut City, and I need your support to make an education program for the pharmacist with official certificate that this pharmacist is ready and able and have enough information and good training for participating in vaccination process, to prepare our pharmacists to participate in this program. This is my point of view, and we discuss it with our respective speakers later. Next, please. Society culture about vaccination in our Arab countries or Arab region, we must inform the people the vaccination process is very important. Actually, this paragraph is copied from a paper published in 2018 in journal Medical Ethics. People who refuse vaccination violate the clean hand principles, moral principles that prohibit people from participation in the collective imposition of unjust harm or risk of harm. This framework individually may be required to accept certain vaccines, not because they have an enforceable duty to serve the common, and not because benefits analysis recommends it, but because anti-vaxxers are wrongful, imposing undue harm upon others. We must educate and enforcing the people for vaccination, and this from where coming from education program. Who will be the educator? The pharmacist. So again, I request the support of FIP and WHO, and I talked with Dr. Wael Ali in Egypt about this program. We need urgent this program, not in Egypt, but in all Arabic countries, to be a big lobby, a big educating lobby, a big well-experienced lobby, I mean the pharmacists, to participate in this program. This is my point of view. Because our role or our aim, from my point of view, is the community pharmacist. And if we are able to make this training program, I'm sure we can participate actually and practically in vaccination process. I'm trying in conference to respect my time, so I'm not talking too long in more than the permissible time. Next, please. Oh, thank you.
Thank you, Dr. Ala, Professor Ala, for your presentation. It is really a very valuable presentation, and we have to also ask ourselves where we are in the vaccination trip and how can we engage everybody in that in this trip. And also, I like what you said, we need active immunizing pharmacists. And this is not available as a whole. Yes. So what we are going to see now, let's share our also experience with other countries. We want to know what we can add and what really we can, FEB can deliver to us and WHO. Thank you very much, Professor.
You're welcome. Thank you.
Anna.
Thank you for your
And now
valuable
I'm handing it over for Dr. Samira to introduce our fourth speaker. Thank you, Dr. Samira. The floor is yours.
Thank you, Dr. Nadia. And again, welcome my president of the Jordan Pharmacists Association, Dr. Zaid Al-Kilani, who is the president of our association, leading its strategic vision and activities to advance pharmacy in Jordan. Dr. Kilani also is a community pharmacist by background and the chief executive officer of Rawhi Group Pharmacies in Jordan. So we would like to hear the story. It might be a little bit different in Jordan, so let's hear it from you, Zaid. The floor is yours.
Thank you, Dr. Samira. I don't know if you can all hear me well.
Yeah.
Wonderful. Dr. Samira, thank you for the warm.
If we could just adjust the camera so we can see your full face.
Oops, sorry, I can't see myself, so that's why maybe.
There we go. Perfect. Thank you.
Okay, thank you, Lina. I honestly want to thank you and thank Dr. Samira for this warm welcome. I want to thank FIP for having us all together from different countries to share our experiences. I really enjoyed Dr. Ziad's and Dr. Alaa's presentations, and I would say that was somehow a case, Jordan's case, 2 years ago, before we started our mission to support the pharmacies and to play their major role as part of the healthcare providers by enabling their role in primary healthcare, where everyone has easy access to effective and affordable vaccines, saving the patient's time and energy. And this was seen in one of the FIP's conferences 2 or 3 years ago, and the presentation was done by WHO regarding specifically flu vaccine. And that's how we all joined forces together to come up with what you're going to see today. The next, please. I'm going to go back for the review of what happened in Jordan and then take it from there. In October 2018, 2,000 delegates from more than 120 countries renewed the commitment to comprehensive primary health care for all with the Astana Declaration. This conference took place in Amman, Jordan, and we came up with the Amman Primary Healthcare Commitment for Action. And that was the first regional FIP conference in Jordan. JPA has adopted the Astana Declaration at that time of transforming pharmacy profession of community pharmacist role, effective and safe use of medicine into the new role of promoting primary healthcare as primary healthcare providers. Building up on that, we worked together to come up with the vaccination program as part of the primary healthcare. Next, please. At that day, that's a picture of the countries signing with Mr. Jordan, where everybody signed for the commitment. Dr. Nadia was there as well. Most of Dr. Adi was there. Everybody was there, and it was the starting point for our follow-up, let's say, and action towards the vaccination in Jordan. Next, please. Based on this commitment, to encourage our pharmacy workforce to contribute more to primary healthcare through the supply of quality medicine, improving medicine adherence, and administering medicine and vaccinations. We have formed a vaccination committee to follow up with all the stakeholders to adjust the legislation to enable and qualify pharmacist administration influenza vaccine in particular at that time. JPA has formed a specific committee advocating immunization 2018, which was led by our Dr. Samira Chammas, chairperson of the Immunization Advocacy Program and FIP vice president, along with other colleagues from community pharmacists, academics, clinical pharmacists, and researchers. Next, please. Our plan was to prepare vaccination guidelines and protocols for pharmacists. In April 2019, we have issued our first booklet titled Jordan Community Pharmacist Immunization Guidelines, prepared by our Immunization Advocacy Committee, adopting and adapting best practices around the world. I have to be very frank and honest and take this opportunity to really thank Dr. Samira for championing this program and following up really intensely with us and the officials to move forward with this. The effort she's put in this program was unbelievable. So thank you, Dr. Samira, for bringing this at this stage. We offered many workshops at that time to enable pharmacist administration flu vaccine. Just to let everybody know, by that time we were just we're doing this, but we have no approval like Lebanon, and it was against the law, or it was not mentioned in the law that pharmacists can give. We've done all of this before, in advance, before taking any approval of administering the vaccine. We did awareness and educational workshops also to the pharmacists about vaccinations. Next, please. We did campaigns. 3 major campaigns were conducted by a group pharmacists in elderly nursing homes in Amman and Zarqa, in places in Jordan. By that time, we did this program with the attendance of doctors or under the supervision of doctors, because we were not allowed to give the vaccination at that time. And those campaigns were specifically for flu seasons and influenza vaccines. Next, please. In 2019, we fought hard to enable pharmacists to administer vaccines in the community pharmacies. We did all the meetings with the officials. We sent letters. Everything went to WHO, MOH, Minister of Health, Jordan FDA. We tried our best to gain the approval and legislation for vaccination by the pharmacists in Jordan. What happened that year is that Jordan recorded few cases of H1N1, and that was somehow of an entrance for us with the government, specifically with the Prime Minister and the Minister of Health, that it is needed to expand the vaccination program with influenza, especially influenza vaccine, to be protected against H1N1. And we got an exceptional approval from the Prime Minister with the support of the Minister of Health at that time to give the vaccines in community pharmacies. It was a conditional approval for that year only, and for that month, just for the couple of months only, just to help give the vaccination. Next, please. In 2020, we got the good news. We kept on following with the officials all the time. Me and Dr. Samira were together in all of those meetings, and we got the approval of having or giving the pharmacists to give the vaccination. Specifically, it was specific only for flu vaccines and seasonal vaccines. So influenza vaccines can now be administered by pharmacists in Jordan, thanks to new legislation and huge efforts that has been done to put that into action. And it was a stepping stone to wider service provision. Pharmacists, of course, need to hold a certificate from JPA confirming their competency to vaccinate. They will take, like Dr. Ziad said, it's not going to be a full year program, but it's going to be a vaccination program. They take how to administer vaccines, how to, it has the CPR, sorry. It has the CPR course. It has, not working. It has the CPR course, and it has the first aid full course certified over 2 to 3 years. To recertified every 3 years with the vaccination course. And it has to be then accredited by JPA and then goes to Jordan Drug and Food Administration to have the license to give the vaccine. Next, please. The approval, as I mentioned, was just for the flu vaccines and the seasonal vaccines only. So we're working now to be able to administer the COVID-19 vaccine if it works, as it's also seasonal vaccine. Maybe not the first year it arrives, because it's going to be through MOH completely, but in the future, hopefully, it'll be through the pharmacies and community pharmacies. National vaccination program for children provided by the government has not been accepted to the pharmacists, as it is given by pediatricians and GPs. And to be honest, we did not push further through that, because we just wanted to start somewhere, as the resistance was so high from doctors and officials. Majority of pharmacies may not have the space to use the private room, because there was certain specific regulations also for the pharmacy to have a specific room for privacy. You know, in our region, we need certain aspects to be there, like a certain room, a private room for the vaccination, a bed or chair, mainly a chair, to administer the vaccines. Certain things have been put through the booklet for that, and the pharmacy needs to provide those to be an accredited pharmacy to give this. Again, this is my presentation for now. I'd like to tell everybody that we got the approval. Now it's official. Jordanian pharmacists can give a flu vaccine and seasonal vaccines in the pharmacy, of course, after finishing the course. And I really want to thank, in front of everybody again, the efforts done by Dr. Samira for us to reach this stage. And thank you very much.
Thank you, Dr. Zaid, for this comprehensive presentation. Proud to be part of rendering the pharmacist here in Jordan a kind of service to be as a healthcare provider. But let me point one more point, that the pharmacy itself is also to be checked and certified by JFDA that it fits and complement the required conditions to give the vaccination. Thank you so much, Dr. Zaid. Back to you, Dr. Nadia.
Thank you, Dr. Samira. Thank you, Dr. Zaid, for your really informative presentation. And we are so happy that it is applied in one of our Arab countries. Thank you very much. Now, it's my pleasure also to introduce our fifth speaker, Dr. Faraz Ashraf from Pakistan. He's graduated in Doctor Pharmacy in 2008 and immediately joined the Ministry of Health, Government of Pakistan in the same year, appointed as a hospital pharmacist in a children's hospital in Lahore, which is among us one of the best institutes in the country. He have been also promoted to Deputy Director Pharmacy in 2014, and also he has served as many areas in the hospital, including administration, compounding, dispensing, drug sampling, community pharmacy of the hospital, and other related departments. Meanwhile, he completed his post-graduation in pharmaceutics. We are so happy that we have you with us, Dr. Faraz, to share with us your experience in Pakistan regarding vaccination, because we want to select and we will see how can we share this vaccination trip also in another country of the Emro region. Thank you. The floor is yours, and you can start your presentation. Thank you very much.
Thank you very much, Dr. Nadia, for the introduction.
You're welcome.
I am Faraz Ashraf. I am working in the Children's Hospital Lahore for the last 12 years. It's the largest pediatric institute in Asia. Next slide, please. As you all know, and the previous participants and speakers vaccination. So I'll not go into the detail about the vaccination. Just let's go to the next slide. What's the procedure for the vaccination in Pakistan? Basically, in 1978, with the name the Expanded Program of Immunization (EPI). At that stage, there were a lot of deaths in the children. So, to prevent the death rate, this program has been started in Pakistan. Afterwards, this program was continued to eliminate the particular diseases. The success and failure of the EPI in Pakistan has different causes, including social, political, and environmental landscapes. Actually, this program was first established to eliminate polio, measles, and neonatal tetanus, to control the deaths. Next slide, please. There are a number of diseases which the world is not facing, but in Pakistan, as being the third world country, we are facing, including polio till today. We have a number of cases of these diseases which are showing on the screen. Vaccination for all of these diseases in that EPI program. The next one, please. But unfortunately, the pharmacists are not included in the vaccination programs, neither by the government nor by the institutes who are teaching the PharmD courses. So the issues faced in Pakistan are people don't believe in vaccination. They don't think that these diseases actually exist. They don't go for vaccination in the hospital. And if someone is telling them about the vaccination, they don't believe it. Then there are limited number of commercial and government plans, like between a child who is not vaccinated with the child who is vaccinated. The government deals with both of them as same. There is no record system for the patients. When a child is born, there is no record keeping, which shows that this child is vaccinated or not. Later on some either earlier stage, when this child at the age of 4 or 5 or 6 goes to the hospital, there is no record showing that this child has been vaccinated with these and these vaccines. Then the financial barriers. People do not afford for their children to be vaccinated. They go to private clinics, but when they were told about the prices of the vaccinations, they avoid vaccination. Then there are political barriers and lack of trainings. There is no training for any health professional in Pakistan, either it is a physician or a pharmacist or a nurse or anyone, particularly for the vaccinations. Then threat for EPI workers. The EPI workers who go from door to door for this project of extended program for immunization, they have even life threats in Pakistan. So the people avoid going from door to door for the vaccination. Moreover, the vaccination rate decreased in COVID-19. The people who are coming to the hospitals before the pandemic, the number of the patients, the number of the vaccinations decreased. And lastly, there is no proper role of vaccination pharmacists in the vaccination. Neither our institutions nor our government has put pharmacists in that particular projects of vaccination. Next, please. So what are the possible solutions for these issues? First of all, establishment of vaccination centers at the community pharmacy setups. Like the community pharmacy is the very first health facility which is encountered by the patient. The patient goes to the pharmacist, community pharmacy. There, the pharmacist can educate him about. Then, incorporation of pharmacists in vaccination plans at hospitals and private clinics of vaccination processes. Then professional pharmaceutical associations to engage health ministries for the incorporation of pharmacists in the vaccination projects. And then awareness programs at different levels, including maternity homes and mother and child care centers where people go for their routine checkups. Next, please. Next slide, please. Thank you. WHO and the other organizations, while announcing the vaccination procedures and guidelines and projects in different countries in Pakistan, must ensure that the pharmacists must be included in that particular project. Like in Pakistan, we are doing vaccination for polio and rotavirus, but there is no concept of pharmacist in our country. So different health organizations, including governments, WHO, FIP, must enforce the incorporation of pharmacists in that particular projects. Then there must be undergraduate trainings on vaccination and inclusion of vaccine programs in the course outlines of Form D, which we are to our undergraduates. There is no proper course outline inclusion of vaccination in that course. Then pharmacists can engage medical camps either for the provision of vaccination or for the provision of information about the vaccination. So this is from and Pakistan. Thank you.
Thank you very much, Dr. Mohammed. I think it is a good also experience about the vaccination and the application of vaccination in your hospital, but I think it needs a lot of also work in it and a lot of programs to enhance more that the vaccination to promote it in all the countries. Thank you very much, Doctor. Now it's our pleasure also to introduce our last speaker, Mohammed Al-Nadli. He's from Yemen, but I think he was facing a little bit of technical problems, but we will see now if he can join with us. He is a lecturer in pharmacoeconomy and pharmacy management, co-founder of CBOS Yemen Community Pharmacy Syndicate, and now he is the president, working in outcome research in Yemen, especially quality of life. Also, he's a pharmacist and plus master science in economy, which is a very good combination, specialized in financial leverage for pharma companies. Also, he got vast majority of experience in drug marketing, especially psychiatry and ADHD specialist, community pharmacist, pharma regulation, and also in academia. He's also, he worked as CPRO for bioequivalence studies as a third-party counselor. Dr. Mohammed, the floor is yours, and let's enjoy your experience in vaccination from Yemen. Thank you very much for joining it with us. If you can join with us, Dr. Mohammed.
Thank you, Dr. Nadia. I'm just going to jump in here.
I think, yeah.
I think, Dr. Mohammed, can we ask you to unmute yourself and let's just try it one more time?
We'll try with you.
Could you unmute and try to speak? You're still muted.
Yeah.
I think that unfortunately we are having audio issues. We have.
So, Dr. Alina, you can start giving his lecture, please.
Thank you, Dr. Nadia. Of course, we would have really wanted Dr. Mohammed being with us here today to do that himself. I will not do justice to his own presentation, but it would be a shame not to at least go through some of the notes that he has provided with us. And what we will do is record a special presentation with him afterwards and append that as part of the recording for this event. It is very important to hear from our colleagues in Yemen. So it's gonna be very brief, but we don't want to miss out on this. And of course, Dr. Mohammed, if at any point you are able to join us by audio, please interrupt me and I'll give you the floor. So of course, in terms of Yemen, Dr. Mohammed provided a very good SWOT situation analysis to really delve deep into the vaccination agenda. So building on a driver-based model. So key players being pharmacists, of course, WHO, UNICEF are all stakeholders in this. The local Ministry of Health is, and of course the community pharmacist plays a huge role in this. So he has identified these as 3 key drivers for the vaccination. One of the points he's mentioned here on his slide is highlighting a leverage point that they can use. So of course we have the 3 outer circles. Sponsoring training and education is really important, and I know that that's been a recurring theme in terms of how important training and education is. Implementing campaigns on antimicrobial resistance to raise awareness to the public on the importance of vaccine and reduce vaccine hesitancy. And the final 3rd circle on the outside is working, of course, with the Ministry of Health to engage in transformation as well. And that's in alignment with the FIP, words we use actually on transformation. And in the middle there, the leverage point is using a partnership with WHO and UNICEF to really drive change locally. So vaccine transformation is really important because it would satisfy societal needs. And these are, again, more drivers that Dr. Nozali has identified that are needed. Cost effectiveness and resource utilization to actually supply vaccines. The presence of the syndicate, the CPOS, or a pharmacy syndicate and a leadership body that supports the agenda and acts as an executive framework to this work. The partnership and influence of working with global partners such as WHO and UNICEF. Building on successful models around the world, and he's just identified here, for example, USA and the work of the Association of American Pharmacists. And of course, we have some successful examples from the region, as just described by Jordan. Driving innovation to solve antimicrobial resistance, ensuring correct documentation and upholding pharmacovigilance during this process, and a globalization campaign that supports promotion locally. Incentives for pharmacy, and I am assuming that this also includes remuneration for pharmacists, so incentive for pharmacies to deliver such services and such value-added services. So I suppose that this could be construed as demonstrating impact of pharmacy by delivering such services. And finally, the blue circle all around again, going back to that quality education and training, very important. And it's just a theme that keeps recurring as a key driver. So priorities from perspective of Yemen is to really harness the partnership and the relationship with WHO and UNICEF as supporters locally and perhaps sponsors. Preparing suitable educational and training programs for the workforce that have an impact on service quality and excellence. And implementing an action plan for awareness campaigns to get sound sharing regarding antimicrobial resistance and the role of vaccination, and to minimize, again, the risk for hesitancy, anti-science and misinformation with other healthcare professionals like physicians, pharmacists, microbiologists, nurses, academics, and health educators, all under the supervision and the engagement and integration with the Ministry of Health and local authorities. And that was a thank you for him, actually, for providing these slides. I'm sorry to hijack them, but we really didn't want to not have this perspective presented. But we will arrange for a private recording with Dr. Nuzali and upload that alongside the original recording of this event to our website. Thank you very much. And I hand back over to our moderators. I believe we're actually ready to take up maybe 1 or 2 questions from the audience. Dr. Nadia, Dr. Samira, are you happy for me to just extract a question or 2 here?
Yes, please, you can, Dr. Alina. And I think you have several announcements also. You can give it to them.
Yes, we will. So just before we start with the question, I'm just going to put up a slide on here, leave it on here to announce and invite everybody to the next regional event, which will cover the Western Pacific, and that will be taking place on the 8th of December at 9 Central European time. We do have a selection of speakers from different countries across the Western Pacific, and similarly to this event, they will also discuss and dive into some of the regional issues and barriers that are facing their region, the Western Pacific. So please join us, and you can register by visiting the website, and I know my colleague will be adding the links on chat. So I think we have some time maybe for a question or two before we close the session. And we have had a very, very engaging audience with us today. We have lots of colleagues from different countries, including Libya, Iraq, who have been echoing the same challenges faced in many countries. And of course, the reality is this region is still progressing in this movement. We have successful examples from JPA, and I have here a comment from a colleague in Iraq, Ali Al-Jamali. JPA is a pioneer in the region in this aspect. In contrast, we still have not started in Iraq to approve pharmacists as immunizers. So I guess this is a very common issue. I'm just going to go to the Q&A box. We have a lot of questions. So we have a question for Dr. Faraz from Pakistan. Actually, if I can call you back on the line, Dr. Faraz. What has been the role of professional pharmacy associations so far regarding the adult vaccinations in Pakistan? I guess this is a general question. We can start with Dr. Faraz. Are you happy to answer this question?
Yeah, can you please repeat it?
So what has been the role of the Professional Pharmacy Association, the Pakistan Association, so far regarding the adult vaccinations in Pakistan?
Yeah, actually the Pakistan Pharmacists Association, can you hear me?
Yes.
Okay, the Professional Association is doing much talks with the Ministry of Health for incorporation of pharmacists in the pediatric as well as the adult vaccination. So in the past few years, when there was no concept of pharmacists in even hospitals and private clinics, today we have incorporated pharmacists at health centers, and now it's mandatory for all the private clinics as well. Then they should have pharmacists in their vicinity. So step by step, we are going ahead.
Thank you very much, Dr. Faraz. There are a few questions in the Q&A box actually addressed to you and specifically about Pakistan. I'd welcome you to go and visit them and feel free to answer them directly by writing. We have another question here, probably to Dr. Zaid Al-Kilani on Jordan from Mireille Muhammad. Regarding COVID-19, what will be the role of JPA in the vaccination of the Jordanian population against the coronavirus? So this is a question about whether the vaccination services currently being legislated will extend to serve the population against COVID-19. Dr. Zaid, would you like to take this question?
Yes, thank you, Lina. Thank you very much. As I mentioned actually in the presentation, for the COVID-19 2021, let's say, I don't think they're going to be the role for the community pharmacists, as it's going to be a government initiative for the first year. There's going to be priority lists. We're not going to have the vaccine on a wider range. It's going to be coming in doses. But for the year after, when everybody's vaccinated for the first year, and as we all know, it's going to be a seasonal vaccine. So every year is going to be vaccinated. It goes under the approval of what we took, seasonal vaccines. So hopefully the year after, it's going to be within the pharmacies. We do have a problem with the mRNA vaccines, though, because of the presentations, the refrigerators, -70. But for the other vaccines, I think we're going to be able to do it in the pharmacies for the year after. The first year is going to be a government initiative, so I don't think it's going to happen in the community pharmacies.
Thank you, Dr. Zaid, for this really helpful context. Wondering, Dr. Samira, having been involved in that, if you'd like to add anything on the Jordanian context.
No, actually, I have 2 points to clear up. Most of the presenters asked the help of FIP for help regarding vaccination. I think FIP does have the toolkit. We have information. They can contact Gonzalo Pinto, and definitely he's ready to provide all the necessary information for that. I think vaccination has to come from the country itself, especially if you have an association, Ministry of Health, you have to work on it within your system. Another point I would like to raise that currently EmroFarm will be renewed, will be part of FIP, and kindly check with your association if you can be member within the EMRO, because it will be part of our strategy to get vaccination in our region. So we will work extensively on this issue within the EMRO. What do you think, Dr. Nadia, about this plan?
Thank you very much, Dr. Samira. It is a great, really, proposal, and I think they will gain by be a member in the EMRO Pharmaceutical Forum, which is part of from FEB. As you said, they will get a lot of programs will be applicable with them, like what we did for vaccination now. We have the Jordan experience, which is really, it takes from you a lot of effort to start it. So we want also to share this with other, if they have any question, because that's a good starter of workforce empowerment as of application of the vaccination programs in our region. For some countries, I think they are ready now to start also like Jordan. And thank you very much, Dr. Samira, for your effort for that one, especially. FIB also will help everybody they have different programs, and when you are a member with us, then you are sharing a lot of access to the programs, and we can also select a second country to help them in implement the vaccination program, like the support give to Jordan. Thank you very much to everybody. Dr. Samira, I think my question is that they are all of them, they are facing a lot of challenges. So how can we facilitate for them for the vaccination? If you can give them that, you are really it took from you 2 years to apply it, isn't it?
Exactly. If
Yes.
I may add, and on behalf of Dr. Zaid and JPA, I think in Jordan, we are ready to contribute whatever, by all means, what kind of help to be part of the trainers at EMRO. So we can, because each country has its own difficulties, has its own specificity. So we need to work with each country. It cannot be copy-paste for everybody the same. So each country has its own policies, its own conditions, and we have to work accordingly. In Jordan, we're ready. What we went through, we might be able to contribute and help if needed and if we can.
Thank you very much, Dr. Samira.
Dr. Lina, can I add something?
Yes, of course, Dr. Ala. One final comment from you, please.
Dr. Samira, Dr. Nadia, if we are going to our target is a self-reading, it is not practical and it is not valuable. What I did mean, education program from EMRO and the FIP. If I am going to focus on the pharmacists to be member in EMRO or FIP and self-reading about vaccination, I think it will be not successful. What I did
Not,
mean
as
in
you
my
said, يعني not
presentation,
cost effective.
no, I didn't mean
cost
achieving. Yes, and I need education program by the help of FIB and EMRO in all Arab countries.
I can answer to that, Dr. Ala. It's one of the outcomes of this vaccination program was there's a need for a guideline and handbook to support countries with the education and training of the workers. So we will be prioritizing such a guideline that can be adopted and adapted in this region and the other regions and in the individual countries within this region. So that is to reassure you that is on our action plan and it is a priority. In addition to this handbook or guideline for education and training, we will be prioritizing the development of toolkits that can support transformation in practice.
Excellent.
And policy as well.
Excellent.
So, and that is exactly why the Transforming Vaccination Program has been designed, is to really consolidate and confirm these needs. And we can see that these emerging needs are common priorities across all the countries and regions. So we assure you that that is something we will do to support our members. And as Dr. Samira said, as Vice President of FIP, being members of FIP will also support you in the uptake and can allow us to work with you closer to help you transform locally. I'm going to ask permission from my moderators to maybe try and close the session. We just want to announce the next session and the summit, and then I'll hand over back to you, Dr. Samira and Dr. Nadia, for final comments before we close. So again, and I'll ask my colleagues to share some links on the chat. Join us on the 8th of December for the Western Pacific region. Even though you are not from a country residing in that region, I think it is helpful to listen to how the other regions are facing similar problems. So you'll see that there are common problems everywhere. And finally, we'd like to, and of course, we'll have some other regions covered next week. But the next final event of this program we'd like to invite you to is the FIP Global Virtual Summit. It is the program finale of the Transforming Vaccination Program of 24 events on the 17th of December at 2 p.m. Central European Time. It is free for all, and it is our first virtual summit, of course, and it is all about committing to action to transform vaccination in pharmacy. We will share the key outcomes of this program and also outline what FIP will be doing to support its members and announcing and launching the global commitment to transforming vaccination. So please join us and register online. I'm going to hand over back final words from Dr. Nadia and Samira, thanking our colleagues and speakers before we close the session. Dr. Nadia.
Thank you very much, Dr. Alina. Really, we enjoy this event, and I would like really sincerely to thank all our distinguished speakers for their really informative presentation. Also, we want to emphasize on the Jordanian experience, that it is a model, and of course it's facing, as the first one applied in our country, it will face a lot of problems. So all of us, we are facilitating, we are trying to help as much as we can. Thank you very much for everybody. Now I'm giving the floor to our co-moderator, if she has, Dr. Samira, if you have anything to say.
Thank you, Dr. Nadia. It was a pleasure having you all with us. Keep contact with us, and we'll try to work it as it should be. Just try, I mean, to take the right decision for vaccination. If you work on it, it will be doable. Thank you.
Thank you very much. We are really, dear pharmacists, we are with you, and for you, we will grow together. Thank you very much, everybody.
Great.
Thank you. Bye.
Have a good day, everyone. Bye.
Have a good day, everybody. Bye.
Bye.
Thank you to all. Thank you very much.